Thank you for joining us once again in our next installment of the Cardio-Echo series. So once again, assistance can be provided by Rick in terms of technical support. And if you have any other concerns, you can contact Claire or me directly as well. And this morning, we have two excellent cases from Amber Black from Metro Health, as well as Dr. Camille Salam from Five Rivers. Dr. Werner is going to be presenting on plant-based diets, and he'll be one of our discussants today, along with Dr. Brzezinski. And these are our disclosures. There's no changes in the disclosures from last week, and you can read these at your leisure. And finally, a reminder to employ patient-centered language as often as possible. The newest addition to this from Dr. Beverly, which I think is quite appropriate, is to avoid violent language, especially these days. Statements like killing it, pulling the trigger, taking a stab at it are probably inappropriate for discussions of this type. Okay, Dr. Werner, please take it away.
Great, thank you, Dr. Rao. Good morning. Again, I'm Jim Werner, and I'm a weight loss behaviorist in a medical weight management clinic that Dr. Rao and I started almost 5 years ago. And during that time, we have worked with hundreds of patients to help them change their health behaviors. And one of those health behaviors, of course, for weight loss is adopting a healthier diet. And typically, this is a shift away from highly processed foods towards a more plant-based diet. And that's what I'd like to talk with you about today. Okay, so our objectives today are to be able to define a plant-based diet, list the benefits of plant-based diets and mitigating cardiovascular risk, and then describe some practical approaches to introducing patients and helping patients transition to plant-based diets. Okay, so we know that diet is very important to health. It's a leading predictor of health outcomes globally, chronic disease risk, and of premature death. However, there are inconsistent messages that the public has kind of been exposed to, and some confusion about really what is the best diet for health, or what are healthy diets. And over the years, recommendations have changed for example, consumption of cholesterol has changed significantly since, say, the 1980s or 90s with emerging research. But media coverage is often really pretty oversimplified, and those messages can be confusing and contradictory. There's also chronic underfunding of nutrition research. And a few years ago, a commentator in Science, the journal Science, said advice on what constitutes a healthy diet is more prevalent and more inconsistent than ever. However, there is scientific consensus on an optimal pattern of eating for most people. And this was coined by the author Michael Pollan, and that is eat food, not too much, mostly plants. And essentially, that is a healthy pattern of eating that works for most people. By eat food, he means eat whole foods rather than highly processed industrial formulations. But there is no single best diet for everyone. As we know, there are people with specific health problems that require specialized diets and medical nutrition therapy, and that is very important. That will always be there. But for most patients and most people, a plant-based diet is an effective and healthful diet. Definition, I think, that works for plant-based diets, and there is no official recognized definition of what a plant-based diet is. But in general, in the literature, it aims to maximize the consumption of nutrient-dense plant foods. Having animal foods in the diet is an option to a lower extent than plant-based foods, and it minimizes highly processed foods. And really, the diets that are recommended in healthcare are plant-based diets. The DASH diet, Mediterranean diet. The USDA My Plate is 75% plant-based foods on that plate. And this is even a committee that develops this every 5 years. It's been criticized for being overrepresented by industry. Even so, 75% of that diet, based on scientific findings, is plant-based. And these really get to nutritional quality more than anything. So foods that are high in nutritional quality, that are low in calorie density and high in nutrient density, as opposed to processed foods, which are high in calorie density and low in nutrient density. And again, this may include fish, lean meats, eggs, and dairy, or it may not, plant-based diets. Next slide. So there are some risks from animal products, from heavily animal product-based diets in terms of intake of saturated fats. Dietary cholesterol is not the risk that it used to be viewed at. Antibiotic exposure, though, is much higher in those eating a heavily animal-based diet. IGF-1 is as well, which is a risk factor for cancer, along with heme iron, and these compounds that are produced when animal products are heated that are also carcinogenic. And then interestingly, carnitine and choline from animal sources increases the amount of TMAO in the bloodstream. And so this is a risk factor as well from a heavily animal-based diet. Next slide. So plant-based diets, run the spectrum from vegan diets, which are diets that are entirely consisting of plant-based foods and avoid all animal-based products, through various formulations of vegetarian diets that include dairy products and eggs, and dairy products and eggs, pescatarian diets, which are plant-based foods and fish or seafood, and flexitarian diets, which include really all foods, but again, animal products to a lesser extent, and trying to eliminate or reduce the amount of highly processed foods. So this is where a number of the diets on the last slide fit in. Next slide. So some of the cardiometabolic findings are pretty significant. And so we see reduced coronary heart disease incidence of 28%, and mortality reduced by 22% in studies of vegetarian diets compared to standard American diets. And a big longitudinal study that has been going on for many years, primarily in California, the Adventist 2 study, they saw significantly reduced prevalence of hypertension in the plant-based groups through all of these years of studying cohorts. And then blood lipids findings can be mixed in many of these studies. Total cholesterol, LDL, and triglycerides are generally lower in plant-based eaters versus standard American diet eaters, but sometimes HDL is lower in the plant-based eating groups that are on the end of the spectrum, the vegan diet groups. Go ahead and go to the next slide. So diabetes risk is also reduced by, there's a odds ratio of 73% or 27% reduced risk of diabetes in vegetarians versus non-vegetarians. And BMI has been consistently shown to benefit from vegetarian diets, plant-based diets. And in these studies of multiple dietary patterns, typically the plant-based groups, vegetarian and vegan groups, have the lowest BMI. In some studies, they're the only groups that have what we consider a healthy BMI. Interestingly, a 6-month plant-based randomized controlled trial found significant weight loss in the whole foods plant-based group versus the control group, which was following a Western pattern diet. But it's important, I think, to note that these diets require pretty significant attention to the intervention in order to help patients adopt these diets. So in this case, in this study, they were having sessions, meetings twice a week to educate people about the benefits of plant-based diets and help them learn how to cook plant-based meals. And so these things don't come easy in terms of changing from Western pattern diet to a plant-based diet. It can be done, certainly, and this is one way that they did it. It's also important, I think, to note that with a plant-based diet, particularly in this case, a whole foods plant-based diet, the patients can eat ad libitum, so they do not need to count calories in this case. In this study, they weren't limited to any certain caloric limit daily. And that's really freeing for patients to not have to wake up every morning and think, I need to keep my intake below 1,800 calories, and I'm going to need to count calories, every one of them. for the rest of the day, potentially for the rest of my life. And that can be exhausting for patients. So heavily plant-based diet can be a diet where the diet is self-regulating in terms of food intake and caloric intake on a daily basis. And patients can just simply eat in the way that they do when they come in to transition to that diet, rather than having to be burdened by a lot of calorie counting and careful weighing of food and all those kinds of things that some people have to do when they're counting calories. Next slide. So the Mediterranean diet also has very significant health benefits. Cardiovascular disease risk was reduced by about 30% in Mediterranean diet. They had two diets, one with olive oil, one with nuts. Both had the same benefit. Diabetes incidence was also reduced very significantly, Mediterranean diet, as well as improvements in blood pressure and insulin sensitivity and so forth. So this diet includes animal-based foods, includes poultry, eggs, dairy products, but to a much lesser extent, red meat and processed foods. Tries to eliminate ultra-processed foods as much as possible. So it is a pretty significant departure from our standard American pattern of eating, which is characterized by high intake of sugar and prepackaged foods, and refined grains, processed meats, and so forth. So this is pretty, a significant change versus just making minor modifications to diet. To get these benefits does require adherence to a diet that's quite different than what most people are the way most people are living in the US and eating in the US. Next slide. So we see these health benefits with plant-based diets of enhanced glycemic control and better weight loss and weight maintenance, improved lipids and lower blood pressure, decreased inflammation, and improved gut microbiome. It is interesting too that the gut microbiome of people who are primarily plant-based eaters is different than the microbiome of those that heavily consume animal products. And this has to do with the conversion, again, of carnitine and choline to TMAO in the diet, to TMAO, which is a significant risk factor. But it does change, the microbiome changes other aspects of health in very positive ways. Okay, next slide. So ultra-processed foods are really, in my estimation, really the problem that's driving our obesity epidemic and epidemic of chronic diseases. So 58% of the American diet at this time consists of ultra-processed foods. So it predominates our dietary pattern. And these are, industrial processes that produce these foods, sweet and savory snacks, things like frozen pizzas, ready-to-heat meals, of course, things like donuts and cookies and crackers and all those kinds of things. Significantly associated with obesity and cardiometabolic disorders. Very few people in our society don't consume any ultra-processed foods on a daily basis. So this is a $1.7 trillion worldwide industry, and we're bombarded with advertising regularly. And so this is very pervasive and a big challenge to help patients overcome this and shift from eating ultra-processed foods predominantly to eating whole unprocessed foods. Because these foods can have a real addictive potential because they're often laden with sugar, fat, and salt, which we prefer based on our evolutionary history. Those were foods that were sought out, that there was little calorie expenditure for a big calorie gain, but now that's working against us in the form of ultra-processed foods. Okay, next slide. So also want to stress that diet quality really matters even among plant-based eaters. So it is possible to have a vegan diet, for example, that is very unhealthy. A diet can be high in refined grains and fruits and fruit juice, desserts, and etc. And as they say, French fries and beer are vegan. So it's possible to actually create significant health risks through an unhealthy plant-based diet. In this case, the studies found 32% increased risk of cardiovascular disease, 15% increased risk of type 2 diabetes versus a healthy plant-based diet, which reduced those risks. So I think it's important when patients are eating a plant-based diet for healthcare providers to perhaps assess the quality of that diet, because that is really the big predictive factor as to whether it's health protective or not. Okay, next slide. So there are a few nutrient concerns with people on the heavily plant-based side of the spectrum. Most vegans take a B12 supplement daily, and then there are these other nutrients that can be deficient if people are not eating a varied plant-based diet. Many of these things can be made up with plant-based foods, but people have to be, if they're going to have a vegan diet or entirely plant-based diet, aware of the potential for nutrient deficiency and be able to pay attention to that. So this takes a little more attention and education typically for those eating vegan diets versus our standard American diet. Next slide. So how do we help patients get started? Well, Dr. Rao and colleagues in the past have developed a technique called opening the door method. And if you want to learn more about that, there have been prior ECHO series and presentations on motivational interviewing where that was explained and demonstrated. So we refer you back to those presentations if you're interested in learning more. But it links to patients' current health concerns and problems and uses motivational interviewing techniques then to elicit motivation. And, I think it's important in helping patients lose weight for initial targets to be in the range of perhaps 5 to 10%. And that does yield clinically meaningful benefits in terms of cholesterol and blood pressure and other measures. So the other thing about this that is valuable, I think, in setting modest targets to begin is that patients can see differences even at this level, because weight, body fat is preferentially or disproportionately lost in the midsection in the early stages of weight loss. So people do see that their clothes are fitting differently, their belt notch, they can tighten their belt a little bit more. And so this is highly motivational for patients, even these modest weight losses. Go ahead, next slide. So for information and support, of course, dietitians are invaluable. They are the experts on nutrition. And so referrals to dietitians can be made to help patients transition to a healthier diet. Cardiac rehab programs are now, there are plant-based diets in terms of programs like the Dean Ornish Lifestyle Medicine Program is covered now by Medicare and many other insurance providers for intensive cardiac rehab. So patients can get really good education and assistance and support in adopting a more plant-based diet through those programs. And health coaches, of course, personal trainers, and the support of family members and friends is important. Next slide. So just want to emphasize that there are a lot of free resources available. Our libraries are full of very good, sound information about these diets and how to adopt these diets. So if patients have limited resources, they're freely available. And then there are cooking courses, national initiatives like Meatless Mondays, and startup kits for beginning how to have a more plant-based diet are pretty readily available on the internet. Next slide. I think it's really valuable to create communities and and for people to be able to connect to a community around plant-based eating if they're taking this seriously. So there are many Facebook groups on plant-based eating and specific diets. Our weight management program has a social media component to it. We also have a weekly support group, peer support group that meets to help patients adopt lifestyle changes in plant-based diets. And some cultures have long-standing plant-based traditions. And interestingly, there is a growing community of African-American plant-based chefs and bloggers, cookbook authors, and so forth that is really a vital group. And interestingly, a Gallup poll showed that African-Americans are the demographic group that is most interested in adopting a plant-based diet, all of our racial and ethnic demographic groups. Next slide. So there, again, are many benefits to adopting a plant-based diet. So that's my presentation today. Gautam, I'll turn it back over to you.
Okay, thank you so much, Jim, for that terrific overview. Any questions? And I had a couple of comments, but.
Yes, I have a question. Hi, Jim. This is Danette. So I just kind of think about, the weight management program, over here where I am at Metro, and possibly let's say 2 to 5% of weight loss can be from behavioral interventions, just kind of modest behavioral interventions, and possibly say 5 to 10% weight loss could be with intense behavioral interventions. And then, this is kind of like how we look at it. And then 7 to 20% could weight loss could be from adding medications. And then after that, it would be more like surgery. But when I hear more and more of my patients who prefer not to have the surgery and they prefer to do it on their own. But then we tell them that there's these limitations, and especially with maintenance. And so I was just curious if there's any, if you already said this, I apologize, but is there any longitudinal data that would suggest that they could lose more than 10% if they stay on a vegan or plant-based diet for, I don't know, 3, 4, 5 years or whatever. And especially since there's a maintenance is a benefit, because maintenance is I don't know, that is the one troublesome area that people can't maintain the weight loss. So I was just kind of curious if there was longitudinal data that supported more than a 10% weight loss on a plant-based diet.
Yeah, there is. And as the study that I cited there earlier, that those that strictly adhere to a plant-based diet, typically vegans and vegetarians who, more than 90%, close to 100% of their food intake is plant-based, do have the healthiest BMIs really in our society. So there have been studies showing that studies showed that vegans are actually the only group with a healthy BMI below 25. So this can be done, certainly, if patients implement this diet and stick to it consistently. The challenge is helping patients make that transition.
Okay, thank you.
Thank you, Jim and Danette. So a couple of things, just partly to address Danette's question. The greatest experiment in plant-based diets comes from the fall of communism in Cuba, where there were tremendous food shortages. People were forced to grow their own food. I just sent out a link that describes it. There are many articles about this. The entire country basically went plant-based overnight. The rates of diabetes went down astronomically. Obesity became uncommon as people had to cycle to wherever they were going. Heart disease declined significantly, I think 30% just over the course of a couple of years. Now, we say this because, first of all, Cuba is a multiracial, multi-ethnic society, not too different from many parts of the southern United States where these are serious problems. So there is very powerful evidence. Now, things have changed again as they've adopted more food sources. I think that's a pretty obvious thing. Jim kind of wisely pointed out that I think the fastest growing population of vegans is actually among African Americans, which is interesting. And I had a medical student years ago, he had medical students who wanted to come do research projects. His was to look at the historical basis of dietary preparation in African American communities. He was from Oakland, California, which is not where his ancestors were from. They were from the South, and he remembered his grandmother, great-grandmother being involved in cooking. And he looked at what people ate in the 1920s and in the early part of the 20th century. It was largely plant-based in his community. And the way that we wanted to frame that as we went out to communities and try to promote dietary modification is as a social justice issue. McDonald's is not traditional in any culture at all. Sugar sweetened beverages are not traditional. Why are you eating something that is not part of your culture? This is part of your culture. And of course, that does inspire some people. But as Jim said, this is a huge, huge challenge to persuade people to do it, because obesity really is an interaction between the individual and their environment. And as Danette was getting to, maintenance is an issue. And if you are vegan, you're going to have a healthy weight and you'll probably maintain it, but you've got to maintain the veganism as well. So a number of things to consider there. Any other comments? I'm just going to read maybe a comment. I think Chris had a comment, but I can't scroll up.
Yeah, as I'll say, I can.
Go ahead. If you want to.
One of the so health outcomes is just one of the few reasons why people will seek vegetarian or vegan diets, which often means that the health and nutritional value is not really the primary purpose, as it is not eating meat. So the data that we've looked at has shown that, you can go and, as Jim said, you can eat beer and pretzels and be vegan, but actually meeting those nutritional recommendations is going to require a lot more attention to detail about what foods provide what nutrients. And yes, it will lead to a reduced calorie intake, but at the same time, our kind of recurring conversation is all caloric restriction then automatically nutritionally adequate? So this becomes a very important consideration in making this. Is it what are we losing in shifting all the way to a vegan diet? What are the nutrients that we lose? What are the nutrients that we need to now compensate? And how do we make sure that we capture those? So it requires a lot more guidance than can usually happen in scrolling a single website, etc.
Okay, thank you, Chris. And I think you pointed out to the different motivations, which we didn't touch upon because we're about cardiovascular risk, but many people adopt vegan diets for social justice reasons. Others, animal welfare is a big issue for people, and global warming and environmental concerns as well. So great discussion today, which is probably why we're out of time. So I'm going to turn things back to Claire for a moment.
Sure. So real quick, we do need one more case study for next week. So if anyone is interested in presenting an additional case, please email me. Rick, next slide, please. The spring echo registration is open. We do have 5 participants so far, and just a reminder that space is limited. So if you're interested in joining us again, please do fill that out sooner rather than later. Again, reach out if you have any questions. Next slide, Rick. And then the cardio webinar, reminder, November 16th, we would love to have you. The registration is on our website as well. You do need to pre-register to get the link. And that is it for this week. Please take the survey. It should be in your email.
Thanks, everyone. Thanks, Claire.
Thank you.
Have a good day.